नमस्कार, मैं रामू भटकर हीमोफीलिया फेडरेशन ऑफ इंडिया की तरफ से हीमोफीलिया पेशेंट्स के लिए ISC 8 का आयोजन दिल्ली में नीला होटल में किया है। इसमें भारत से सभी हीमोफिलिक्स और उनके डॉक्टर्स जो पॉलिसी मेकर्स हैं हर स्टेट के वो आए हुए। मैं आशा करता हूँ जल्दी ये पॉलिसी बने और भारत के सभी हीमोफिलिक्स को इसका लाभ मिले।
Please have a big round of applause for our chief guest today, Dr. Harsh Mangla, Director, National Health Mission. Shri Premru Palwa to please welcome our chief guest with a bouquet of flowers, a token of our love.
So what we call 3 pillars of effective hemophilia care management is we want to identify people early, provide them proper management with accurate treatment, which involves multidisciplinary cares, physiotherapy, dental, etc. care, and there should be an option of prevention. And what is needed is a national guidelines or treatment which makes the entire system, the entire ecosystem much more better and more smoother. Thank you so much.
Last year we were approving all the factor drugs, but there was a gap in our system because these drugs were not in essential drug list. So how we can approve them, and finally the drugs were added.
Now I request Dr. Cecil Ross to please come to the podium.
We are going to start gene therapy in India soon. Clinical trials are already on. So once you have a gene therapy, it is getting closer, and how it will impact these products, I don't know. But it's a great times to be, because all the treatment options will be available.
Now I request Vice President Finance, Mr. Jagdish Sharma, to please deliver the vote of thanks.
I express my gratitude to our chapter key persons and the entire executive committee of the HFI. Special thanks to the doctors across the country for their unwearying support for the cause of hemophilia. Thanks.
Our first speaker today is from Government of Maharashtra, Dr. Chandrakala from KEM Mumbai.
Prophylaxis is the only treatment which can change the natural history of hemophilia. In the next 20 years, if you want to reduce the number of surgeries, start prophylaxis now and make the patient independent with the musculoskeletal deformities.
Our next speaker is Professor Tulika Seth, Chairperson for Ministry of Health and Family Welfare and MOTA 2022 for sickle cell disease.
Sometimes we come across patients who are still a little bit scared of prophylaxis because they fear inhibitors. There are many studies now to show that patients who are on prophylaxis have less risk of inhibitor development. And there are many new products in the pipeline, so it's a very exciting time for us.
मैं धन्यवाद कहना चाहूँगा जिया जी और प्रभुराम जी जो उनके मतदार संघ के हैं जो सर को लेके आ गए।
May I request our esteemed guest to please address the gathering.
मैं बच्चों को विकलांगता से बचाने और रोगियों को अच्छी देखभाल प्रदान करने के आपके प्रयासों की सराहना करता हूँ। मैं आपकी यह भी अवगत करना चाहूँगा कि इस विषय में आपके द्वारा दिए गए सुझाव भी मेरे संज्ञान में है। उन सभी को न्याय देने की पूरी कोशिश करेंगे। धन्यवाद। जय हिंद, जय महाराष्ट्र।
Dr. U.R. Rahul, Regional Director of Kerala Social Security Mission, and is currently the State Nodal Officer for Child Health and Rare Diseases.
Now, the most important part was to monitor this. We have this centralized web-based registry where we conduct the monitoring of the factor consumption, monitoring of the annual bleed rate, monitoring of the quality of outcome, and based on that, we could do a cost analysis based on the patients who had frequent bleeding, and based on that we selected the subgroups. So to switching on to novel therapies, we actually initially selected children who were inhibitor positive. Later we selected adults who were inhibitor positive and who were frequent bleeders, where the cost of treatment with the recent medications were far more economical when compared to the previous medications with VIII.
We have now from Government of Karnataka, Dr. Meera V. from Bangalore Medical College and Research Institute.
It is important to envision and plan comprehensive care setup in at least one or two in every state and address the challenges with collaborative and innovative solutions. And the role of patient support and education is very important, and multidisciplinary and multi-stake partnership is very crucial in this.
We have now Pin Kulkarni from ICMR Mumbai, Government of India.
Now, ideally, if you are based in a hospital, then the coagulation lab should ideally be giving 24-hour service, especially for factor VIII and inhibitors, because that matters a lot. It is very essential to have good communication between the hemostasis laboratory and the clinics. That communication is extremely essential to not have any confusions regarding what product is given, what investigation is to be done, what reagents are to be used. Thank you.
What is the current scenario of hemophilia treatment and access in your state? How can patient organization, government can help to improve the situation?
We will begin our session by a talk by our VP Medical on the topic of paradigm shift in hemophilia care.
So going from what we used to do earlier, when I started my career in hemophilia, it used to be symptomatic therapy at home, rest, ice, compression, elevation. All of you have gone through this. And then we had the factor concentrate that came. And now we have non-factor concentrate, where the equivalent of factor VIII is about 20-30%. Person is perfectly normal. So these are all the shifts that have happened.
I would like to call on stage Dr. Urmila KV from the Government of Kerala.
Structured education programs for people living with hemophilia is very important, and the prophylaxis program definitely should be strengthened, because that definitely improves the QOL. And strengthening of physiotherapy. From my research, I found that regular and structured physiotherapy is not a part of life of many hemophiliacs. So it should be, and the training of the doctors in the public sector and primary care physicians should be well updated regarding the recent current changes that is happening in the industry.
I would like to invite Dr. Neeta Radhakrishnan.
Over the years, there has been recognition that even heavy menstrual bleeding, if it is requiring visit to a doctor, as in requiring transfusions, requiring iron, etc., it is important, and they have to be reported and they have to be evaluated further. So there are several campaigns across the globe which is running on girls or women with heavy menstrual bleeding to talk about it, to reduce the stigma associated with it and come out in the open and get an evaluation done.
Our next speaker is Dr. Manish Chaudhary. He is the State Program Officer, Blood Cell, NHM, Rajasthan.
Health is a state subject और राजस्थान का हेमोफीलिया के जितने भी फैक्टर्स आते हैं उसका 99% बजट स्टेट बजट से आता है, पीआईपी से ओनली 1%, क्योंकि पीआईपी क्या करता है, गैप फिलिंग करता है. आप उसका जब मैंडेट पढ़ेंगे तो आपको पता लगेगा कि वो गैप फिलिंग करता है. जब स्टेट गवर्नमेंट किसी चीज़ के लिए बजट अवेलेबल नहीं कराना पाती है, जहाँ भी गैप्स हैं उनको फिल करने के लिए NHM है. सो दिस इज द मैंडेट. कोई नई चीज आती है उसको हम यहाँ PIP में प्रपोज करते हैं और वो हमें मिलता भी है.
I would like to invite Dr. Sunil Taneja from the Shushruth Medical Center, Kanpur.
Let's talk about prevention. We have a chapter in Kanpur which has about 500 registered members, and every patient of hemophilic has to have a genetic evaluation. So can I stop for a minute and ask the people who are there who are hemophilics, आप सबका हीमोफीलिया का फैक्टर लेवल हुआ होगा, क्या आप लोगों का जेनेटिक एवैल्यूएशन हुआ है? नहीं हुआ ना. सो दिस इज एज इम्पॉर्टेंट एज गेटिंग अ फैक्टर लेवल टू लेबल कि सिवियर हीमोफिलिक है या माइल्ड या मॉडरेट है. सो आई थिंक मोस्ट ऑफ द पेशेंट्स नाउ रिक्वायर फैक्टर लेवल टू बी लेबल्ड एज डिसेबिलिटी. सो दैट्स द इम्पॉर्टेंट थिंग.
Next talk by Shri Uma Shankar Sharma. Shri Sharma is the Commissioner for Persons with Disabilities, Government of Rajasthan.
लास्ट वीक ही मेरे पास 2 बच्चे आए थे थैलीसीमिया और हीमोफीलिया से. उन्होंने आकर मुझे बताया कि सर हम बहुत परेशान हैं, सभी दिव्यांगजनों को 4% आरक्षण के हिसाब से नौकरी के अंदर ऑप्शंस मिल रहे हैं, बट हमें क्यों नहीं दिया जा रहा. तो ऐसी स्थिति में मैंने लास्ट वीक जो हमारे को पावर्स दी गई हैं RPWD एक्ट 2016 में एज ए सिविल कोर्ट, मैंने एक सू मोटो ऑर्डर उसके अंदर बनाया ताकि आने वाले समय में जो हीमोफिलिक हैं या जिनको भी आज दिव्यांगजन के कैटेगरी में लिया गया है उन्हें इसमें शामिल किया जाए.
Now like to invite Dr. Hitesh Mule.
There are a couple of molecules that we are currently working on. First is a mostacimab, which is anti-tissue factor inhibitor. It's a novel entity that we are looking into, and it is for an adult population and the pediatric population that we look into, and it can be considered for both the patients. So we see this could revolutionize the treatment of hemophilia going in the future.
I would like to call upon stage Shri Guru Prasad Pavaskar sir. He is the Commissioner for Persons with Disabilities, Government of Goa.
I had an opportunity to interact with most of the chapters in Goa during the International Purple Fest. I said it's once of its kind because we had almost 50,000 persons with disabilities who came to Goa during that 6 days period. What was the main purpose of having this is, we could gather all those NGOs who are working in the field of disability on one particular platform. We normally see a lot of NGOs working in this field. They are doing a fabulous job, but everybody is working in their own areas in the silos. So it was a good platform for them to do a networking, to come together, exchange ideas and move ahead. And I'm very happy that Department of Empowerment of Persons with Disabilities, Government of India now wants to take it to different states.
Pavaskar sir, he has actually changed the landscape of disability. I think he's the first officer who gave everyone an equal opportunity and a platform, and created a unique subject which happens only internationally. We hear about something called celebrating a disability, okay, recognizing it, okay, and giving the confidence of living with it. He reached out to every disability organization in India. In the second year, with Sir's leadership, from a national program, it became an international Purple Festival. Hats off to you. Thank you so much.
Now like to call upon stage Dr. Naresh Gupta. He is the organizing secretary of IHC.
ये जो विमेन है जो कि अछूती हैं हीमोफीलिया से, क्योंकि वो स्ट्रांग है, एक बीमारी से जो अछूती नहीं है वो उसकी सिस्टर बीमारी है हीमोफीलिया की, उसको कहते हैं फॉन विलेब्रेंट डिजीज. और उसका कारण है कि हीमोफीलिया एक्स लिंक्ड है और फॉन विलेब्रेंट डिजीज एक्स लिंक्ड नहीं है, ऑटोसोमल है. तो एक तो ये कि वो हल्की है, दूसरा ये कि ज़्यादा कॉमन है, तीसरा है कि उसको ज़्यादा लॉन्ग टर्म इम्पैक्ट है जो हम एनीमिया का देख रहे हैं, और चौथा ये है कि इट इज़ एक्चुअली एम्पावरिंग द वीमेन एंड द स्मॉल गर्ल्स. सो गर्ल्स एंड वीमेन एम्पावरमेंट के लिए हमको ये अलग से लेके चलना चाहिए कि हीमोफीलिया का हम इलाज यहाँ कर रहे हैं, अब इसमें हम उसको भी शामिल करें. शामिल हमने पहले भी करा हुआ था लेकिन वो उतना एम्फेसाइज नहीं हो रहा था, और अगर आप उसको शामिल करके करेंगे तो गर्ल्स की एंड वीमेन की हेल्थ भी इम्प्रूव करेगी, और जो हमारे नेशनल मिलेनियम डेवलपमेंट गोल्स हैं वो भी ज़्यादा इम्प्रूव करेंगे.
like to call upon stage Professor Tulika Seth.
इस अवसर पर उपस्थित होने पर और अपने विचार साझा करने के लिए सभी सम्माननीय वक्ताओं का मैं आभार व्यक्त करता हूं और आज का ये प्रोग्राम यहाँ पे ख़त्म हो गया ऐसा जाहिर करता हूं। बहुत बहुत धन्यवाद। थैंक यू सो मच।